The interclinician. Citizens and health service have a special contract to provide help to those in need. It is a relationship between therapist and patient based on trust and responsibility. In the future, organization of health services and new technologies play a new role for the meeting between patient and therapist. But how does this affect the trust to be able to get help and to get the full responsibility for your own treatment? Which patients can become future home patients? Traditionally, clinicians take all their senses in use. However, not all patients are in need of acute, around-the-clock surveillance, as when they are hospitalized. For many diseases where the treatment is completed, it is important to keep an eye on specific symptoms and organs over time. Regular measurements provide patients and healthcare professionals with an impression of stability and possible development in the disease. Various technological designs intensify the health professionals' awareness on selected disease conditions, such as oxygenation of blood, blood pressure, pulse, and so forth. These are snapshots of different conditions in a body that has disease symptoms. If we repeat the measurements of the body's snapshot conditions often enough, they become measurements of body rhythms that give insight into the patient's health status over time. For instance, the development of blood glucoses or blood pressure. Such measurements can give some patients an improved course of treatment as they avoid waiting in hospital beds or wasting time on transportation and parking prior to their checkup, and as a result, giving the patient more personal freedom. What are the conditions for the clinical responsibility when it is to be shared with patients themselves in their own home? The patient must have accepted his illness and have enough knowledge about it to provide self-care and carry out the work with the measurements themselves. The patient's informed choice and consent involve a clarity of who installs the technology in the home and where the technology should be placed. It also involves how the patient interprets his own data. The measurements should also make sense for the patient and possibly also his relatives. Home monitoring is therefore also about cooperation with IT vendors and health professionals, so that both the technology works and the measured values make sense for the patient. Cooperation with other professionals and organizations. Good and responsible home monitoring is thus also dependent on that healthcare professionals are aware of who is responsible for which tasks, and that there is established good cooperation with IT support in relation to installation, training, maintenance, and removal of equipment. Also, the organization's framework for working with patient data is essential. Is there a policy in relation to office space and quiet time for data analysis work? Is there both time for the traditional ambulant patients and those being monitored at home? Are they equal, and do they not depend on one another? The entire patient. An ICT treatment provides only a reduced insight into your patient's body. Technically, it is possible to measure many things and create a lot of data, but not all data is equally interesting and worth taking a clinical responsibility for. Equally, it must be accepted that the patient can choose to take leave from the disease and not take responsibility for it as expected. There are also conditions that would be difficult to gain insight into without using all the senses, for example, to smell an infection. It is important to establish a good communication channel with the patient. Communicating using video call may provide a rich insight into the patient's life. The patient may also have multiple diseases and the need for multiple monitor calls. Is there a common clinical solution in support of it, or is it up to the patient to coordinate? The good interclinician requires an experienced professional clinician with knowledge of all the stages of disease development, both hospitalized, ambulant and home patient, in order to properly assess which course of treatment and knowledge the patient should have for an optimal course of treatment. The future home patient is thus not only a question of technology, but just as much a question of cooperation with the appropriate clarifications of assignments, training, and allocation of responsibilities.